Thank you, Mr. Chairman. Welcome, Secretary Price. It's good to have you back here in the Ways and Means Committee room. As you know, I represent South Florida, specifically the Florida Keys, which is one of the most beautiful parts of the world, but it's a county where residents who don't have employer-based health insurance or government-sponsored health insurance have one single insurance provider. That means no choices for the people of the Florida Keys. Like so many Americans, they have become accustomed to higher premiums, fewer choices, and lower quality. So I certainly support the idea that we need a better healthcare system for our country. However, while Congress considers what that new system will be, I do think we need to protect the most vulnerable. And I'm glad that this administration has committed to funding the cost-sharing reductions that are dedicated to supporting Americans who would have a lot of trouble accessing the healthcare system but for them. And I'd like to encourage all of my colleagues here in the Congress to follow that lead and to support, during this transition period, funding this important program. Also, Mr. Secretary, I wanted to bring up the National Institutes for Health. As you know, South Florida was hit hard last year by the Zika crisis. Obviously, it was a public health threat. It was also an economic threat to our community. Can you commit to supporting the NIH and all of their efforts in research, in vaccine development, to make sure that if the threat of Zika returns, which we are nearing the season, that our government is prepared to support communities like South Florida and others throughout the country that are exposed to this threat?
Yeah, thank you. Because of the resources that Congress has provided, a significant resources have gone into the production of the discovery and production of vaccine for Zika. We're in phase 2B trials, as you likely know. Very exciting time, and we're very hopeful that that we'll be able to bring that online rapidly.
So you can commit that all of those programs, all of that work that's being done is going to continue for the foreseeable future?
Absolutely. It's a priority of the department and of the NIH, and it's a priority of the administration.
Thank you very much, Mr. Secretary. I yield back, Mr. Chairman.